The Permanent Secretary of the Federal Ministry of Health, Mr. Mamman Makhmouda, said monitoring and evaluation has become a major part of the ministry's budgetary process in order to effectively check the execution of projects and programs. Represented by the Director of Health Planning and Statistics, Dr. Ngozi Azadu, the Permanent Secretary highlighted the importance of focusing on assessment of the impact projects and programs have on average Nigerians, rather than just funds releases and spending. Speaking with journalists on the execution of projects, Mr. Makhmouda reiterated that with the present situation of the economy, particular attention must be paid towards cost effectiveness and diligence in the execution of health projects and programs.
There are several agencies of government that are working with us to make sure that the budget is implemented as approved, and they're also trying to throw in their way to bring in solutions, towards ensuring that we get the expected outcome. In the last 1 or 2 years, there has been a lot of infrastructural development in the health sector. And we've also looked at policy issues. We are looking at mobilizing domestic resources for health, what we call the pro-health taxes. We're also looking at local manufacture of vaccines. We're looking at strengthening our health security across all the pillars of the health system.
Similarly, the chairman of the Independent Corrupt Practices Commission (ICPC), Professor Bolaji Owasoneye, represented by a director in the commission, also disclosed that the commission has monitored health sector-related projects in all its tracking exercises and has followed through to ensure that unexecuted or abandoned health projects are completed, while those completed are followed up to ensure they are put to use. He noted that the Commission is currently investigating COVID-19 related spending in some health institutions, and the findings so far are not very palatable. During the meeting, stakeholders reviewed the 2021 budget performance and analyzed the 2022 budget to ensure the delivery of the health sector's mandate.
If you don't have your early release of funds, the plan that you have put in place, you won't be able to actualize it. When you budget for an activity or a project, and after the budgeting process, you now realize that inflation has crept in, there's a process for you for virement. There's a window for you to get virement.
If everybody actually live and does their expenditure within the appropriation, there's no how you are expected to have liabilities.
We are worried sometimes when we see the level of infrastructure or level of delivery of the health sector. We trust that we can do better, and we hope that we can do better. Many have criticized the 724 billion, that's about 4.2% of the 17.16 trillion budget allocation for healthcare across the 36 states and the FCT in the 2022 budget.
The stakeholders also decried the inefficiency of the country's budgetary allocation for health, noting that more has to be done in order to improve the nation's healthcare sector. Lois Abasambo, ASO Television News.